Hello and welcome. This video will cover all of the information for this topic. Feel free to watch the full video, or if you prefer, you can scrub along the timeline at the bottom and jump straight to the section of your choice. Physical inactivity is currently the fourth leading risk factor for global mortality, and it's responsible for 1 in 6 deaths within the UK. There is a clear evidence-based link between regular physical activity and a wide range of positive health outcomes, including improved cardiovascular health outcomes, such as reduced risk of stroke, hypertension, and coronary heart disease. Regular physical activity reduces the risks and potential severity of respiratory conditions, such as asthma and chronic obstructive pulmonary disease. It also improves metabolic and musculoskeletal health, reducing the risk of developing numerous other conditions, including type 2 diabetes, obesity, osteoporosis, and certain cancers. Physical activity also improves functional health, reducing the risks of falls, especially in older adults, and plays a significant role in improving mental health and reducing the risk of associated cognitive conditions, such as anxiety, depression, and stress. Increase in physical activity levels among the global population is a key focus of the World Health Organization and domestically by Public Health England. Fitness professionals play a significant role in increasing physical activity levels within their local communities, advocating regular participation and adherence. When planning activity and exercise to maintain or improve an individual's health and fitness, it should be enjoyable and challenging, with specific adaptations which progress training intensity over time to bring about continued progress towards the client's goal. To bring continued progress towards a client's goal, the FITT training principle can be used to program a client's training. This is an acronym for frequency, intensity, time, and type of training. When planning using the FITT training principle, the planning should reflect the goals and current fitness level of an individual, with considerations to the following. The frequency of training. This is how often you should plan for a client to complete the training program throughout the week. Being considerate to an individual's time commitments, such as family and work, and the recovery time also needed between sessions, with less fit individuals requiring more time to recover between sessions, which will allow you to create an appropriate plan. The intensity of exercise prescribed will be determined by the individual factors, such as the client's existing fitness and skill level, along with the training methods to be used, such as high intensity interval training or low intensity steady state training. Intensity should be progressed slowly and when the client is ready to be progressed. The time dedicated to training is dependent upon the available time the client has, along with the type and component of fitness which is to be planned. Rest times between sets and exercises should also be factored into the total training time, which is to be planned for the client. The final FITT training principle adaptation is the type of training. This includes the different training methods, such as interval, fartlek, strength, or hypertrophy training. These methods are focused on specific components of fitness and should be appropriate for the desired goals of the client. The minimum activity guidelines recommended by the American College of Sports Medicine and the National Health Service are created in the form of these FITT principles for different modalities of exercise. When working with a client, the first priority of a fitness professional is to facilitate the minimum recommended guidelines for physical activity, covering all components of health. These include cardiovascular, muscular endurance, strength, and flexibility. The minimum physical activity guidelines for apparently healthy adults between 18 and 64 years of age include achieving at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week. It's also recommended that muscular strength and or muscular endurance exercises, along with flexibility exercises, are completed on a minimum of 2 occasions per week for all of the major global muscles of the body. For some individuals, it may not be possible to achieve the recommended levels of physical activity due to their current decondition or possible health status. Therefore, the following considerations should be given for these individuals to achieve as much as they are capable of and to reduce the intensity to a manageable level, with reduced sessions of up to 10 minutes in duration, which are progressed over time using the FITT training principle to the recommended levels of physical activity. Clients should be as active as their abilities and conditions allow, with clients who achieve success having their targets reassessed, with new achievable goals being set towards the recommended physical activity levels or potentially higher. Clients over 65 years of age will also greatly benefit from the inclusion of specific functional activities up to 3 times per week, such as balance and mobility exercises, including sit to stand and core strength training. If clients are healthy and are currently achieving the minimum recommended guidelines, then they may benefit from specific American College of Sports Medicine guidelines for additional goal improvement. Additional goal improvement may include muscular endurance, muscular hypertrophy, muscular strength, or flexibility improvements. If an individual is wishing to focus on a specific goal improvement, it is also recommended that the individual also achieves the minimum recommended activity level within all other components of fitness. The definition of muscular endurance is the ability of the muscles to work continuously under low to moderate resistance. The recommended FITT training principle guidelines to develop muscular endurance is training the muscle groups 3 to 5 days per week at a moderate intensity of 40 to 65% of 1 repetition max. The amount of work which is recommended is 12 or more reps for 2 to 3 sets, with a short rest of 30 seconds or less between sets. It may be more appropriate to use resistance machines for endurance training, as there is less danger to safety during times of higher repetitions and muscular fatigue, as movement is limited within the machine. However, any compound and isolation exercises will achieve the desired results, ensuring a balanced program with a rest of 48 hours between training sessions to alleviate the delayed onset of muscle soreness and promote optimal recovery. The definition of muscular hypertrophy is the ability of muscles to increase in size. The recommended FITT training principle guidelines to develop muscular hypertrophy is training each of the muscle groups twice a week at a moderately high intensity of between 65 and 85% of an individual's 1 repetition max. The amount of work which is recommended is 6 to 12 repetitions over 3 to 6 sets, with a rest of between 30 and 90 seconds between sets. It may be more appropriate to use free weights when training for hypertrophy to recruit synergistic and fixator muscles, achieving greater motor unit recruitment. A balanced program with a rest of 48 hours between training sessions will alleviate DOMS and promote optimal recovery. The definition of muscular strength is the ability of the muscles to exert maximum force against a high resistance. The recommended FITT training principle guidelines to develop muscular strength is training the muscle groups up to twice a week at a high intensity of over 85% of 1 repetition max. The amount of work which is recommended is between 1 to 6 repetitions over 2 to 6 sets, with a rest of between 2 and 5 minutes between each set. It may be more appropriate to use free weights and focus on compound movements, which will recruit synergistic and fixator muscles, achieving greater motor unit recruitment. A balanced program with a rest of 48 hours between training sessions will alleviate DOMS and promote optimal recovery. The definition of flexibility is the range of movement which is possible at a joint or series of joints. The recommended FITT training principle guidelines to develop flexibility is stretching the muscle groups up to 3 days a week, ideally daily, and stretching to mild tension. Individuals looking to maintain their flexibility should hold the stretch for between 10 and 30 seconds, with individuals looking to develop their flexibility aiming to hold a stretch for 30 to 60 seconds on each of the major muscle groups. It's recommended to complete flexibility exercises after a thorough warm-up or at the end of the main session to reduce the possibility of any injury. A fitness professional must keep in mind that a client cannot progress to reach their goals without a suitably planned program in FITT principle training progressions. If a program is planned which is too high in intensity or too short in duration, then they will not be optimal and a specific training goal may never be achieved. The inverse intensity to volume relationship illustrates that as intensity is increased, volume must be decreased. This is to avoid potential overtraining, leading to illness, possible injury, and regression. By ensuring the inverse intensity to volume relationship is achieved during programming, will enable achievable progress to be made and reduce the potential risks of overtraining and possible injury. An example of this is a program for developing muscular endurance, using a lower intensity of under 65% of an individual's 1 repetition max, and a high volume of 12 or more reps over 2 to 3 sets, than that of a program for developing muscular hypertrophy, which would use moderate intensity between 65 and 85% of an individual's 1 repetition max, and a moderate volume of 6 to 12 repetitions over 3 to 6 sets. Finally, a program for developing muscular strength would use a high intensity of over 85% of an individual's 1 repetition max and a low volume of between 1 to 6 reps over 2 to 6 sets. Public Health England recommends exercising every day. However, fitness professionals need to program to minimise the possibility of overtraining, as this will lead to a reversal of any benefits achieved. Overtraining occurs when an individual does not rest and recover sufficiently, such as training through DOMS, training which is too intense for a deconditioned client, and when trying to push through plateaus. Overtraining can be identified by the following possible signs: reduced or impaired performance, loss of coordination during exercise, a reduced ability to concentrate, possible irritability, hypersensitivity, and mood changes during daily life, disrupted sleep patterns, an increase in lethargy or possible fatigue, and an increased susceptibility to common colds and potential acute illness. It's recommended to allow at least 2 days rest between muscular strength, endurance, or power training sessions to allow for optimum recovery to take place. The considerations a fitness professional must have when designing programs to optimise an individual's performance, recovery, and minimise the injury risk include the client's current fitness level, matching the intensity of the session. The client's ability level also matches the technicality of the session. To be aware of the client's current injuries and or possible limitations, and to make sure that these are adapted for during the session. Active rest and or recovery, making sure that this is planned during the session or throughout the program if appropriate, with regular reviews, evaluations, and adaptations to be implemented on a regular basis if and when necessary, dependent on the progress being made by the client. There are many different types of training methods that can be used to design programs for clients, with some being versatile, with variables that can be manipulated to suit certain goals, and other methods only focusing on one particular component of fitness. Therefore, it's a fitness professional's role to fully understand each training method, its purpose, benefits, risks, and requirements, to ensure suitability of specific training methods when planning a client's programme towards their desired goals, with key considerations being whether they can perform the training methods with safe and effective technique. Within this unit, we will look at the various cardiovascular training methods, including continuous, interval and fartlek training, resistance training methods, including basic sets, supersets, combined sets, pyramid sets, fatigue sets and strength sets, and common flexibility training methods, including static and dynamic stretching, along with proprioceptive neuromuscular facilitation. Each of the different cardiovascular training methods are suited to specific goals. However, by changing the intensity and duration, they can be adapted to suit the client's needs. The different methods of cardiovascular training which we'll look at include continuous and interval training, along with fartlek training protocols. Continuous training involves sustained intensity for set durations and includes methods such as steady state, long slow duration and tempo training. Interval training techniques involve specific intensity with fixed work to rest periods throughout the session and includes methods such as aerobic, anaerobic, high intensity interval training and Tabata protocols. Fartlek training involves undulating intensity for various work to rest periods which change throughout the session. Steady state training is an aerobic based cardiovascular training system which is suitable for beginners as it's excellent for developing general adaptation and aerobic conditioning. Steady state training involves an individual sustaining a steady, low to moderate intensity for a set duration, typically between 60 and 75% of their maximum heart rate for around 20 to 60 minutes. The potential disadvantage of steady state training is that it can be boring and demotivating for some clients, so therefore it's not suitable for everybody. It may be necessary to find a mode which is more enjoyable, such as walking or cycling over running or rowing. Long, slow distance training is also an aerobic based cardiovascular training system, which is a form of continuous training suitable for intermediate clients, aimed at building a strong aerobic base for individuals typically looking to complete an endurance event of 10k or further. Long, slow distance involves an individual sustaining a steady, low intensity for a set duration, typically less than 65% of their maximum heart rate, for 45 to 180 minutes or potentially longer. Long, slow distance training requires a lot of time and patience, so it's most useful for clients who are training for specific endurance performance reasons, where the training mode should be specific to the event which the client is looking to complete in. Tempo training is an anaerobic threshold-based cardiovascular training system, which is a form of continuous training suitable for advanced clients, aimed at improving their race speed or developing greater lactate tolerance as training is maintained at lactate threshold. Tempo training involves an individual sustaining a steady, moderate to high level intensity above the onset of blood lactate, known as OBLA, and around the maximum lactate steady state, known as MLSS. This is where the level of intensity can be maintained over time without a continual increase in blood lactate accumulation, which would be too great and impair an individual's performance. Typically, intensity will be between 70 and 80% of an individual's maximum heart rate for around 10 to 40 minutes in duration. This tempo training can also be completed as intervals, while the client builds up tolerance to the fatiguing effects of blood lactate. Interval training can be varied to meet specific goals and fitness levels of the client by simply adjusting the durations of work to rest ratios and intensities. They are often preferred options over continuous training, as clients find intervals less monotonous where focus can be achieved for longer. Aerobic interval training, also known as low intensity interval training, is an intermediate based training system which is focused on improving aerobic conditioning. Aerobic interval training involves an individual sustaining intensity slightly above the onset of blood lactate accumulation, known as OBLA, typically around 75 to 80% of maximum heart rate, before active recovery below 70% of an individual's maximum heart rate. Individuals should aim to achieve an equal work-to-rest ratio of 1:1, working for 3 to 5 minute intervals before dropping their intensity to active recovery intervals for the same duration of time. Aerobic interval sessions should last between 20 and 90 minutes, depending on the goals and the fitness levels of the individual. Anaerobic interval training, also known as moderate intensity interval training, is an intermediate-based training system which is focused on improving anaerobic conditioning, promoting recovery, and increasing exercise tolerance. Anaerobic interval training involves an individual sustaining higher intensity than aerobic training, typically over the maximum lactate steady state of around 85 to 90% of maximum heart rate, before active recovery, which is lower and longer than aerobic intervals, to promote greater recovery, ideally below 65% of an individual's maximum heart rate. Individuals should aim to achieve a work-to-rest ratio of 1:3, working for between 30 and 180 seconds, before dropping the intensity for active recovery for treble the amount of time. Anaerobic interval sessions typically last between 10 and 60 minutes, depending on the fitness levels of the individual, and the session should stop when the client is unable to achieve a suitable working intensity. High-intensity interval training protocols have become popular over the last few years due to research showing that it has many health benefits, including improved blood pressure and cardiovascular health in a short period of work time, and is also associated with the maintenance of muscle mass. High-intensity interval training is also a popular training system as it can be adapted for use with both cardiovascular and resistance training modalities. High-intensity interval training is an advanced training system which is focused on improving maximum output and VO2 max. High-intensity interval training involves an individual sustaining high intensity, typically over 95% of maximum heart rate, before active or total recovery below 50% of maximum heart rate. Individuals should aim to achieve a work-to-rest ratio of 1:5, working between 15 and 25 seconds, before dropping intensity or resting for intervals of 75 to 125 seconds, with longer work intervals requiring longer rest intervals to recover. High-intensity interval training should last between 5 and 30 minutes, dependent on the goals and the fitness levels of the client. Tabata training is a specific variation of high-intensity interval training introduced by Dr. Tabata in 1996. It's an advanced training system focused on improving maximum power output and recovery. Tabata training involves an individual sustaining absolute maximum intensity before short total recovery periods on a 2:1 work-to-rest ratio. Tabata training method consists of 8 maximum intensity intervals of 20 seconds work, with 10 seconds total rest between each interval, totaling a 4-minute session. Fartlek training is Swedish and it's a term that means speed play. It's a type of interval training which has less rigid structure than traditional intervals. Fartlek training has a planned objective, with intervals being varied in duration and intensity throughout the session, which mimics the work and active rest periods typically associated with team sports. Fartlek interval training, also known as varied intensity interval training, is an advanced-based training system which is focused on improving specific goal outcomes of a client. Fartlek training involves combining different intensities of low, moderate and high intensity over the duration of the session. Fartlek intervals will have a varied duration of work and rest ratios, along with a variation of total session time, which should be aimed at mimicking the demands associated with the goal outcome, typically the same as those within a football or rugby match, for example. There are many different resistance training methods, each being better suited to a specific client goal. The resistance training methods covered within this unit include basic sets, supersets, combined sets, pyramid sets, fatigue sets, and strength set protocols. Basic set training involves a specific number of repetitions performed with a given weight for a given number of sets. It includes methods such as single, multi, and circuit sets. Superset training involves 2 different resistance exercises back to back with little or no rest between. It includes methods such as agonist, antagonist, pre and post exhaust sets. Combined set training involves a group of more than 2 different resistance exercises back to back with no rest in between, consisting of tri and giant sets. Pyramid set training involves the manipulation of intensities and volume over the course of multiple sets of the same exercise. It includes methods such as ascending, descending, complete, and wave loading pyramid sets. Fatigue set training involves performing an exercise to failure before alteration to continue the exercise. It includes methods such as drop sets and partial repetitions. Strength sets are used to overcome natural concentric effort and elicit greater mechanical effort of the muscle. It includes methods such as negatives, clusters, forced, and cheat repetitions. Basic set resistance training forms the basis of a typical resistance training session and can be described as a specific number of repetitions performed with a given weight for a given number of sets. Basic set training can be easily adapted to develop different types of muscular fitness, including muscular endurance, hypertrophy, or strength, by adapting the working intensity and volume. Single set training systems is suited to individuals beginning resistance training in wishing to achieve general adaptation to the stimulus while also avoiding excessive DOMs. Individuals would complete 1 set per exercise before changing the exercise. Typically, a whole body approach would be used, training all of the major muscle groups throughout one session. The number of repetitions completed are specific to the goal which is desired, with the rest between each set staying consistent and also specific to the goal. A multi-set training system is suited for individuals who are familiar with resistance training exercise and are looking to achieve specific resistance-based goals, such as hypertrophy or specific strength goals. Individuals would complete 2 or more sets before changing exercise, typically training a selected area of the body during a single session, such as the upper or the lower body. The number of repetitions completed are fixed for each set and are specific to the goal outcome which is desired, with the rest between sets staying consistent and also specific to the rep range used. A circuit training system is an intermediate training system for individuals with limited time or looking to keep their training varied. A circuit training system consists of a series of resistance exercises performed in sequence, one after another, with minimum rest between each exercise, and with training variables being manipulated to achieve a desired outcome. Circuit training systems can be vertically loaded, where each exercise is performed one after another until the first set is complete, then the second set is completed. They can also be horizontally loaded, where each exercise is performed for all of the sets before moving on to the next exercise, or more commonly, timed or repetition focused, where each exercise is performed for a specific time period or number of repetitions. Circuit training can be varied or specific, focusing on different elements of fitness or areas of the body, such as upper or lower body only for strength or endurance, or peripheral heart action system, which alternates between upper body and lower body exercises throughout the circuit, distributing blood flow between the upper and lower extremities, improving equine circulation. Superset resistance training methods involve completing 2 different resistance exercises back to back with little or no rest between exercises. They are a time-efficient training method which can be used for various goal outcomes. An agonist superset training system is an intermediate resistance training system which is focused on developing muscular endurance. Individuals would complete 2 different exercises focused on the same agonistic muscle back to back with no rest between, such as a bicep barbell concentration curl, immediately followed by a biceps dumbbell hammer curl. The number of repetitions completed are fixed to both exercises and are specific to the goal, with rest between sets staying consistent and specific to the rep range being used. An antagonistic superset training system is also an intermediate resistance training system which is focused on developing muscular hypertrophy or strength. Individuals would complete 2 different exercises focused on opposing muscles back to back with no rest between, such as a bicep barbell concentration curl, immediately followed by a tricep cable kickback. The number of repetitions completed are fixed to both of the exercises and are specific to the goal, with rest between sets also staying consistent and specific to the rep range being used. Pre- and post-exhaust variations of the agonistic superset training method involve the fatiguing of key muscle groups by including isolated exercises before or after a compound exercise in an attempt to create increased overload in a targeted muscle. Pre-exhaust superset training systems are an advanced resistance training system which is focused on the local agonistic muscular development, with synergistic fatigue occurring at the same time at the end of a superset. Individuals complete a single joint isolation exercise with no rest before completing a compound exercise on the same agonistic muscle, such as a supine dumbbell pec fly, immediately followed by a barbell bench press. The number of repetitions completed are fixed to both exercises and are specific to the goal outcome, with rest between sets staying consistent and specific to the rep range being used. Post-exhaust superset training systems are also an advanced resistance training system which is focused on global agonistic muscular development and maximal motor unit recruitment. Individuals complete a compound exercise with no rest before then completing a single joint isolation exercise on the same agonistic muscle, such as a barbell bench press, immediately being followed by a supine dumbbell pec fly. The number of repetitions completed are fixed to both exercises and are specific to the goal outcome, with rest between sets staying consistent and specific to the rep range being used. Combined set techniques are an advanced resistance training technique which requires the completion of 3 or more exercises which all work the same muscle group back to back with no rest between exercise. Tri-set training systems are focused on developing muscular strength endurance, where individuals would complete 3 different exercises focused on the same muscle group back to back with no rest between exercises, such as a front, lateral and prone deltoid fly. The number of repetitions completed are fixed to all 3 exercises and are specific to the goal, with the rest between sets also staying consistent and specific to the rep range being used. Giant set training systems are also focused on developing muscular strength endurance, where individuals would complete 4 or more different exercises focused on the same muscle group back to back with no rest between exercises, such as a military press, front, lateral and prone deltoid fly, followed potentially by an upright row. The number of repetitions completed are fixed to all exercises and are specific to the goal outcome, with the rest between sets staying consistent and specific to the rep ranges being used. Pyramid set training methods involve the manipulation of intensity and volume over the course of multiple sets of the same exercise, with relevant rest periods in between each set. A pyramid set training system involves inversely increasing or decreasing the load in relation to the reps, which can recruit all motor units and muscle fibre types in a short period of time. It's efficient to use a plate-loaded fixed weight resistance machine to be able to quickly and efficiently adapt the weight. An ascending training pyramid set is an intermediate resistance training system which is focused on developing muscular hypertrophy and or strength. Individuals would complete a moderate intense set with a high number of repetitions before then resting. The intensity would then increase with each set, with the number of repetitions being reduced at the same time. The rest time will also increase between sets, specific to the requirement of the intensity being used. Once an ascending pyramid has been completed, individuals will then change exercise, either on the same muscle group or changing to a different muscle group, depending on the focus and goals of the session. A descending set pyramid training system is an intermediate resistance training system which is focused on developing muscular strength endurance. Individuals would complete a high intense set with a low number of repetitions before resting. The intensity would then decrease each set, with the number of repetitions being increased at the same time. The rest time will also decrease between sets, specific to the requirement and intensity being used. Once a descending pyramid set has been completed, individuals will then change exercise, either on the same muscle group or change into a different muscle group, depending on the focus and goals of the session. Complete or total pyramid training systems are an advanced resistance training system which combines hypertrophy, strength and endurance into one complete training system. Individuals complete an ascending and descending pyramid with relevant intensity and reps, with the rest time altering between each set appropriate to the intensity being used. Once a complete pyramid has been completed, individuals will then change exercise, either on the same muscle group or change into a different muscle group, depending on the focus and goals of the session. Wave loading is an advanced method of pyramid training which is focused on developing peak strength and power due to post-activation potentiation. Individuals complete 2 or 3 consecutive ascending pyramids with a low rep range, with the first pyramid set at the lowest intensity, and the following pyramid sets increasing in intensity, creating a wave-like pattern, with the rest time between each set and pyramid staying consistent and suitable for the intensity being used. Like pyramids, wave loading is intense, so exercises should be suitable for the technical ability and fatigue level of the client. Fatigue sets are typically completed at the end of a session, as the demand is so great, typically achieving total neuromuscular fatigue and a decrease in functional performance once a fatigue set has been completed. Drop sets or strip set training systems are advanced resistance training systems which are focused on developing muscular hypertrophy or strength. Individuals' starting load allows for failure within the appropriate rep range specific for the desired goal outcome. Once failure has been reached, a small percentage of the load, typically between 5 and 20%, is removed, and the client would immediately perform as many reps as possible, with the drop in load being repeated until terminal failure. Drop sets are best used with fixed weight resistance machines, as it's easier to modify the load. Drop sets are very demanding as they extend beyond normal concentric failure limits. They should be used sparingly to ensure maximum recovery between training sessions. Partial reps or matrix training is an advanced training system which completes an exercise in a limited range of motion. Partial reps can be used in many situations, such as to increase the strength of a weak end range movement, or improve the range of motion for a specific muscle or group of muscles for improved functional capacity. Bodybuilders also use this technique to complete reps in the muscle's strongest mid-range to increase motor units and hypertrophy benefits. Depending on the goal outcome will depend on the intensity, rep range and rest time between sets to be used, with overuse of this method potentially causing the muscle to adaptively shorten to the new functional range, especially if the program does not include any flexibility. A commonly used method of partial reps is to break the full range of motion into 3 stages: the top, bottom and full range of motion. This type of training is typically called matrix training or 21s, as a rep range of 7 repetitions for each range is used. Completing matrix training focuses development on 2 different ranges of the muscle length before fatiguing the muscle with a full range. Due to the increase in time under tension of the muscle, a moderate load should be used for each exercise, with the focus being more on developing muscular endurance rather than strength or hypertrophy as in partial rep ranges alone. However, as a full range of motion is achieved over the full set of 21s, this does not cause the muscle to adaptively shorten. Strength sets are typically completed at the end of a session as the demand is so great, achieving total neuromuscular fatigue and a decrease in functional performance once completed. Negative reps are used to develop strength and should be completed after a warm-up set of a moderate load. Pure form negatives are where a supramaximal load, typically around 105% of an individual's 1 repetition max, is slowly eccentrically lowered over a 4 to 6 second period. A spotter then supports with concentric movement before the process is repeated, typically over 3 to 5 repetitions, with 1 or 2 sets being performed. A combined application of negative reps is when they are used after forced repetitions. In this approach, the client performs a set of an exercise until they reach concentric failure. Once failure is achieved, the spotter then assists the clients with the concentric lifting phase to get over the sticking point, but provides no assistance during the eccentric phase of the exercise. This is completed as one final set at the end of the session and should only be performed once per week due to the overload being placed on the neuromuscular system. Cluster sets, also known as pause training, is a method that is used to develop maximum strength and power. This method of training allows the individual to work at a higher intensity than usually would for a traditional set, and is intended to maximise loss of technique and performance during maximum intensity. Intensity would be specific to the client's goal, typically above 85 to 90% of 1 repetition max, with the appropriate number of repetitions in the set being around about 4 to 6. Short rests or pauses of up to 30 seconds between repetitions would then be taken, allowing for enough recovery to perform each repetition with maximum explosive power and minimal loss of technique. This is a good method of training when completing complex compound movements such as deadlifts, squats and any Olympic movements. Forced and cheat repetitions both use the same principle to overload a muscle past fatigue, with one using a spotter and the other using momentum without a spotter. Forced repetitions are an advanced resistance training system which is focused on developing muscular hypertrophy and strength. Individuals complete the appropriate rep range specific to their goals of either strength or hypertrophy until failure. Once failure is reached, a spotter then helps them lift the last 2 to 4 repetitions before terminating the set. The assistance given by the spotter must be minimal so that the individual can progress past the sticking point. Forced repetitions are best used with free weights, where strict technique and form is maintained throughout, and typically at the end of a session due to the overload and fatigue caused. Cheat reps are an advanced resistance training system which is focused on developing muscular hypertrophy or strength. Individuals complete the appropriate rep range specific for their goals of strength or hypertrophy until failure. Once failure is reached, the individual uses their body's momentum without a spotter to aid in the completion of an additional 2 to 4 repetitions before terminating the set. Cheat repetitions are best used with free weights, where momentum and gravity can be used Form is maintained throughout but may be compromised in a safe manner. Each of the different flexibility training methods are more suited to specific outcomes and appropriate to be used throughout different phases of a training session. The different methods include static, dynamic, and proprioceptive neuromuscular facilitation protocols. Static stretches are held without moving and include methods such as active, passive, maintenance, and developmental protocols. Dynamic stretching are controlled movements through full ranges of motion with varying speeds and include methods such as dynamic and ballistic protocols. Proprioceptive neuromuscular facilitation is assisted stretching which manipulates underlying neuromuscular principles known as the autogenic inhibition and the inverse stretch reflex to maximise the effects of a stretch, and these include methods such as contract-relax and contract-relax agonist-contract protocols. Active and passive flexibility are both forms of static stretches which can be held for varying amounts of time and tension without moving to produce a specific flexibility outcome. Active stretching is when the focused muscle is moved into position and then actively held in a static position using the surrounding musculature. There is no other external force applied to increase the muscle length. Therefore, it's limited with the amount of tension which can be applied. Active stretching promotes a high neuromuscular control and coordination, however, achieves a limited increase in muscle length. Passive stretching is when the focused muscle is moved into position and is actively held in a static position using external forces such as a wall or a resistance band. As there are external sources applied to increase muscle length, varying amounts of tension can also be applied. Passive stretching promotes lower neuromuscular control and coordination, however, achieves a greater increase in muscle length. Maintenance and developmental flexibility are techniques of static stretches which are held for varying amounts of time, typically post-session during a cool-down. Static maintenance flexibility stretches are where the muscle is taken to the end of its normal range and held without bouncing, typically for 10 to 30 seconds until the muscle relaxes. Static maintenance flexibility stretches are used to maintain the normal length of the muscle. Static developmental flexibility stretches are where the muscle is taken slightly beyond its normal end range and held without bouncing. Static developmental flexibility stretches usually involve 3 stages of progressive stretch where the limb is moved slightly further each time the muscle relaxes, with each progressive hold in length lasting 30 to 60 seconds. Static developmental flexibility stretches desensitize the muscle spindles as the tension increases. Autogenic inhibition is initiated and the muscle relaxes, generating an immediate and moderate increase in muscle length. Dynamic and ballistic stretches are completed under control through a full range of motion and are typically included prior to a session starting as preparation. Dynamic stretching is useful during warm-ups as it combines both bodyweight flexibility training with continuation of the warm-up. Dynamic stretches should be performed in a controlled manner with good technique across a full range of motion for around 6 to 12 repetitions. Dynamic stretches promote proprioception and muscular activation prior to the start of a session. Ballistic stretching is a form of dynamic stretching which involves the use of momentum from controlled explosive movements to develop flexibility prior to high demand explosive activity. Ballistic stretches should be performed in an explosive but controlled manner with good technique over 4 to 6 repetitions. Ballistic stretches serve to potentiate the central nervous system and prepares the neuromuscular system for high intensity activity. Proprioceptive neuromuscular facilitation, known as PNF, is a form of passive developmental stretching which manipulates underlying neuromuscular principles known as autogenic inhibition and the inverse stretch reflex to maximise the effects of a stretch. PNF stretching should be used when the clients are warmed up thoroughly typically at the end of a session, and incorporated into a program for clients looking to develop their flexibility. There are two types of PNF techniques: the contract relax, also known as post-isometric relaxation, and the contract relax agonist contract method. In the contract relax or post-isometric relaxation method, a passive stretch is held for 10 to 15 seconds before then isometrically contracting the targeted muscle at 50% effort for 5 to 6 seconds. The muscle spindles desensitize after 10 to 15 second hold, with the Golgi tendon organ then being triggered after an isometric hold, causing autogenic inhibition. This then allows for a short window of opportunity for the passive stretch to be increased beyond the muscle's normal range. This technique can be achieved 2 to 3 times in succession until no further short-term improvement can be obtained. In the contract relax agonist contraction method, this is a passive stretch with active involvement and is again held for 10 to 15 seconds before then isometrically contracting the targeted muscle at 50% effort for 5 to 6 seconds. The muscle spindles desensitize after 10 to 15 seconds hold, with the Golgi tendon organ then being triggered after an isometric hold, causing autogenic inhibition. This then allows for a short window of opportunity for the passive stretch to be increased, with the client actively increasing the range, which also initiates reciprocal inhibition, increasing the targeted muscle's normal range. This technique can be achieved 2 to 3 times in succession until no further short-term improvement can be obtained. Caution must be taken if using proprioceptive neuromuscular facilitation techniques, as they are completely contraindicated for anybody with weakened, unstable or loose joints because of the potential risks of strains, subluxation or dislocation. Most of the training methods which we have just looked at can be adapted to suit different client goals. However, some are more naturally suited to specific goal outcomes such as endurance, hypertrophy or strength training than others. When planning appropriate training methods for your clients, always ensure that specific methods to be used are suitable for the client goals. Once an appropriate training method has been selected, always ensure the correct protocols for that method are being used, such as appropriate timings, intensities, volumes, and time under tension. Ensure that the client is familiar with and understands and is capable of the safe execution of the training method. The training methods used should be focused, with 1 or 2 methods being used simultaneously towards goal achievement before progressing to another stage or goal. Above all, training methods should not be contraindicated to the client and should be both enjoyable and achievable to ensure adherence to the program and ultimate success. Fitness professionals must continually adapt training programs and variables to progressively overload clients towards their goals. This is achieved through the SAID principle. The SAID principle is the primary principle of training, and the acronym stands for Specific Adaptation to Imposed Demand. Specific relates to the training stimulus needed to mimic the desired purpose. For example, if an individual would like to improve their strength, then a suitable training method with appropriate variables such as intensity and volume must be considered. The body adapts over time, with adaptations occurring due to the body's ability to change to specific imposed stimulus, making future exposure to the stimulus easier over time as the body systems supercompensate in the reflection of the demand. Essentially, by training specific to the area of required improvement is the biggest factor of improving that particular component. There are many reasons you may wish to adapt a client's training. This may be due to overtraining, fatigue, injury, or to increase the training stimulus and continue progression with overload towards a client's goal. Adaptation can include regressions, which make a stimulus less challenging, progressions, which make a stimulus more challenging, or modifications, which changes the training stimulus or exercise, typically to a more or less complex movement or training method. Once identified that a client's training needs regressed, progressed, or modified, then this can be achieved by adapting the stimulus using the FITT training principle of frequency, intensity, time, or type. The FITT training principle can be used to adapt short-term variability of the session or program to suit the needs of the client and their goals. By altering a single stimulus enables you to clearly identify the success or failure of the change, and the further ability to make corrective alterations to the change if the desired results are not being achieved. Some adaptations using the FITT training principle include regressing the frequency, where you could reduce the reps, sets, or amount of training days which a client completes, with progressions to frequency increasing these variables. Regressing the intensity, where you could reduce the weight, RPE, or heart rate which a client completes, with progressions to intensity increasing these variables. Regressing the time, where you could reduce the work, increase the rest a client completes, with progressions to intensity being increasing the work or decreasing the rest time. Finally, using the FITT training principle, you can modify an exercise or training method by regressing it and making the exercise less complex, or progressing the exercise by making it more complex. Care should be taken to ensure that progressions are suitable and appropriate for the client, while also keeping to the training objectives such as endurance, hypertrophy, or strength training protocols. The FITT training principle can also be used to adapt any medium or long-term training variable or goal, such as adapting different components of health. Some adaptations using the FITT training principle for the different components of health include reducing the weekly sessions or overall distance to regress endurance, or progress the component by increasing the weekly sessions or overall distance covered in training. Regressing strength components can be achieved by reducing the intensity of the weight which the client completes, with progressions to strength coming from increasing the intensity of weight or training method being used. Regressing flexibility components can be achieved by reducing the range of motion or time a stretch is held, with progressions to flexibility coming from increasing the range of motion or time a stretch is held. Finally, using the FITT training principle, you can modify an individual's body composition, regressing it to homeostasis and promoting recovery by reducing training intensity or volume, and progressing an individual's body composition by increasing training intensity or volume over time. The FITT training principle can also be used to adapt any medium and long-term training variable or goal, such as adapting different components of skill. Some adaptations using the FITT training principle for the different components of skill include reducing isolation exercises to regress coordination, or progress this component by including more complex and compound movements. Regressing reaction time can be achieved by increasing familiarity of movement, with progressions to reaction time coming from decreasing the familiarity of movement. Regressing agility can be achieved by reducing the range of motion or complexity of a movement, with progressions to agility coming from increasing the range of movement or complexity of a movement. Regressing power can be achieved by reducing the intensity of a stimulus, with progressions to power coming from increasing the intensity of a stimulus. Regression of balance can be achieved by increasing the stability of movement, with progressions to balance coming from reducing the stability of a movement. And finally, regressions to speed can be achieved by increasing the time under tension, with progressions to speed coming from decreasing the time of tension of a movement. Monitoring clients when exercising at all times is not only good practice, but ensures their safety, efficiency of movement, and encourages motivation and adherence. Aspects to monitor during training include the exercise, speed, equipment, and protocol which is being used, that optimal exercise technique is being performed, and that the weight, along with the speed of movement being used, is appropriate for the client's skill level and the method being used. Adaptations should be immediately made if the client's safety is ever compromised or if the training method is not achievable due to fatigue. Ensuring that you are focused and attentive to your client will enable you to give appropriate verbal cues or adaptations which may be required. When observing clients, ensure that you observed from an appropriate position, which is not too close or domineering, and ensure that you observe from different angles, if appropriate to do so, to ensure optimal technique. Be empathetic and non-judgmental, ensuring that you are looking through a positive lens and not staring or looking disapprovingly. Always inform the client what you are viewing and promote the use of mirrors, videos or images to inform the client of their technique and promote education through optimal movement. Sometimes it may be appropriate to stop or correct a client exercise technique for safety reasons, with verbal cues to the client being suitable. When correcting technique, ensure cues are non-critical and developmental in nature. Cues should be clear and appropriate, with reinforcement of the primary points if needed. Always ask a client's permission to go hands-on to assist in optimal positioning or movement, and only correct compromised technique, praising optimal technique. It may be necessary to re-demonstrate or offer alternatives if a client is unable to perform an exercise safely or effectively. You have now completed all of the content from this topic. If you have any questions from what was covered, please contact your tutor. Or if you'd wish to test your knowledge, why not try some of the mock questions? If you're happy with your progress in learning, feel free to move on to the next topic.